Hello, I'm Emily Tullock. Today we are meeting to bring information to the community about supports and services available to children and families on Cape Cod, Nantucket, and Martha's Vineyard. April is Child Abuse Prevention Month, and we have representatives from two organizations which support healthy children and families in our community. Today we are joined by Cindy Horgan, Executive Director of Cape Cod Children's Place, and Jacob Stapledon, Community Engagement and Education Coordinator at Children's Cove. And they're here to discuss each of their organizations, roles, and ways that all parents of our diverse community can receive support. Raising a family is the most important and challenging thing that they can do. They know that when families have support, have a safe space to talk to somebody, and get resources to meet their family's needs, the healthier that family is. Now to start, we have Cindy Horgan. Please tell us about you and the programs of Cape Cod Children's Place.
Well, first of all, thank you, Emily, for having us here today to share this. So Cape Cod Children's Place is this amazing organization. Home base is in East Ham. Our footprint, however, covers the Cape and the islands with our services. We have many arms to what we do. We provide early education and care in the Lower and Outer Cape for the 0 to 5 population, supporting families, many of which we work hard to provide assistance to be able to pay for that. In addition to that, we have free parent-child early literacy groups, free parent education, one-on-one consults, home visiting, and in addition to that, our bigger footprint covering the Cape and Islands is working with families in the journey of recovery from substance use disorder. And so we will do home visiting one-on-one with those families through that journey. And so all of our services under the family support portion of our organization are free to everybody in the community.
That's great, thank you.
Thank you.
And Jacob, can you tell us about Children's Cove, please?
Absolutely. So Children's Cove, we are the Child Advocacy Center for Cape Cod and the islands. So we serve all of the towns of Cape Cod as well as Nantucket and Martha's Vineyard. What we do is we work collaboratively with investigative agencies such as law enforcement, the Department of Children and Families, and the District Attorney's Office for the comprehensive and best practice response to cases involving crimes against children. So specifically that's related to child sexual abuse, severe physical abuse, witness to domestic violence or crime, as well as commercial sexual exploitation of children, which is often more referred to as human trafficking. So we work collaboratively on all of those cases to support the best practice investigation for children between 2 and 17 years old. We provide medical supportive services for children under 2 and as well as for all of our clients. And we also provide those investigative services for individuals that are 18 and older if they have a developmental disability or they have special needs or other types of care where they would need a more compassionate approach. So we provide those investigative supports and services as well as the best practice response to all of those cases regarding family support and services and community programming, mental health coordination to trauma-informed providers, pediatric medical care for sexual assault nurse exams or non-invasive physical wellness exams, as well as providing community education, awareness, and training around safety, prevention, and early recognition of child abuse and how to effectively respond to that. So we're a department of Barnstable County government, and so all of our services to individuals that do come to Children's Cove are completely free, and then we'll work to ensure that the referred services to them are at a very low cost, if not free as well.
All right, well, thank you both so much for those introductions and overviews. Now, Cindy, can you tell us more about the Save Child Communities initiative?
Yes, so thank you. So we are the pilot or the initiative for the Children's Trust in Massachusetts for the Safe Child Communities Grant, which is Stop Abuse for Every Child. We have been fortunate to be in relationship with the Children's Trust since 2004, where we began as a family resource center. The intention of this particular grant, which allows us to really go even deeper into our work, is really coming from a lens of strength-based work, that we know if we build the protective factors within every family, then we are building and putting forward every family can be a family of promise and build resiliency within them. So the Safe Child Communities Grant allows us to do those programs that I was mentioning, the parent-child early literacy groups, the parent education, which is really at a high level and really brings families in of all shapes and sizes, as well as that one-on-one, with a family that's able to call to say, I'm really struggling. My 3-year-old just, I don't know what's wrong, but they seem like they're crying all the time. And we're really able in those really sort of, I don't want to call them dark moments, but really hard moments for some families to be able to help them understand child development, understand what they can do to support their child during sort of these bumpy roads that every human being is going to have. So we are so fortunate with the Safe Child Communities grant that really allowed us to dive even deeper into how we do this work. A big portion of it, and we've always been in relationship with the Children's Cove, but it allowed us to deepen those relationships because we know that it's not just the Children's Cove and it's not just Cape Cod Children's Place. So many of our community partners are critical in the way that we do this work. And the Safe Child Community Initiative, that was one of the big pieces, is how we bring all of these partners together. And it really takes my breath away to watch how this happens. Just yesterday, for example, I had 2 calls back to back that had their relationship, their journey began with the Children's Cove. But because of the services we offer, we were able to really blend what we do together to support these families. So not one place is going to have all the answers, but together we can create some amazing opportunity for families.
Yeah, and that's where our partnership has been for so long, is the fact that as a community and as a focus at a child advocacy center, we really look at what are all of those elements that's going to help support a child and their entire non-offending family holistically, right? Not just related to what is the reason why somebody may have come to Children's Cove, what's the reason why somebody may have initially come to Cape Cod Children's Place, is what are all of those elements that are going to provide that safety, security, comfort, and growth for the healthiest outcome for that child and their entire family to support them. And that's why these partnerships, again, not just with one another, but to those other organizations out in the community, are so imperative and critical.
Yeah, it sounds like there's a lot of collaboration in the community, and
absolutely.
Cape Cod families and children are very lucky to have access to these services. That's wonderful. And now, what are some of the barriers for families that are getting in the way of these protective factors?
Wow. As beautiful as Cape Cod is, and it is gorgeous, isolation can often be a tremendous barrier. It's no surprise here. Economically, it is really hard to sustain yourself in this community and have safe housing, and be able to also not only have safe housing, but access to healthy foods and all of those things there. And over time, though, I really, as beautiful as it is, and the seasons are really remarkable here, winters can be long and they can be hard. And I think that those are some of the barriers that we often see. And
yeah, with some families that we're supporting specifically at Children's Cove, is there may have been a significant interruption into their life, and where their trajectory of what they had thought was going to happen in their life may suddenly change based on the nature of why they're there. There could be a caregiver that's no longer in the home, or it may have shifted dramatically family relationships. It may impact their economics, their ability to pay for housing, the ability to have childcare as effectively at home. When you maybe are now we're in a 2-parent home, but now you may have a single-parent home, or the way that finances are supporting that childcare and support. It can really make a big difference. And when you are throwing a kind of a wrench into the works of what can be supporting a already established healthy family, it increases those risks, that stability, that comfort, and everything that are needed. And that threshold for safety and security on Cape Cod is higher because of the cost of living and housing and those elements of isolation and transportation. And so where we try to help build those bridges are to these amazing community resources, like the programs offered at Cape Cod Children's Place at low or no cost, or really work together and say, okay, how can we support this family through this hard time to get them to the other side of it? What are our resources and our supports to help empower them to move them forward? So.
And I think another barrier is more of a cultural piece for us all, and that is, if I'm asking for help, I must be really broken. And how I think a lot of our energy is spent helping people to understand that reaching out for supports or direction or guidance or just to be connected is actually a strength within a family. And I think that's a hard thing for us to understand, to see asking for help as a strength.
Yeah, definitely. That Cape Cod resiliency, that belief that's been here for so long of, oh, well, I don't need that help because there's somebody else who needs it more. There's so many incredible organizations that are on Cape Cod that want to help support as many people as they can. And so not moving past that, but recognizing when is this asking for support actually really going to benefit the strength and help and protection of my family, and working through that is really important.
Absolutely. Asking for help is very, very difficult. And now, what are ways that families can reach out to receive services to support raising healthy families?
We do a lot. Jacob does amazing stuff on social media, and I'm jealous of what he's able to do. But we do, we kind of do our outreach in many different ways. Lots of people connect with us by word of mouth. But we have our websites and we have our Facebook posts and our social media posts. But a lot of it is just boots on the ground, and showing up at a school and saying, we just want to let you know this is what we're doing. And so all of a sudden the school's like, okay, I got a family that I think would benefit from this. Making sure all the different agencies like police departments and fire departments know who we are and what we do, because very often they're the first engagement for many of our families that can really benefit from some of the resources that we can share with them. And so it's really about educating the community about who we are and how to do that. And I think what's really important to that question is if somebody calls me and I'm not the place for them, there's about a 99.99% chance that I know where to send them, and to do a warm handoff, to say, you know what, I'm going to call my friend Jacob, and I'm going to have him, what would you prefer, him to call you or you to call him, and how do we make that? And I think that's what sets the Cape apart from other parts of the state.
Yeah, and that's something that is so important, is we want everyone to know is we're accessible. I think it can be daunting, depending on the type of circumstance that you're in or the issue you're facing, to call maybe who might be that first thought, right? If you're worried about there being something that's happened to a child or to a family member, nobody necessarily wants to jump at and call law enforcement right away, because there's those fears of, well, what if I'm overreacting, or what if there's nothing really here, or is somebody going to be mad at me, or are they going to find out about this, right? And that's where we try to really make ourselves at Children's Cove available, that if you have questions, if you just want to talk through a situation with someone, you can do that anonymously. You can contact us just by calling. That we have a chat line on our website that people can use anonymously there and just ask questions. But exactly like what Cindy said, is sometimes we may not be the right place, but what we can do is we can help facilitate that connection to who that right person is, who is going to be that person that we can say, hey, I'm going to connect you to Cindy, or I'm going to connect you to Detective whoever it may be, to make that direct connection, so that somebody doesn't feel as though they're wandering through this alone. When people do make that decision to reach out to ask for help and support, it is imperative that we and any organization says, we've got you. We're really happy that you reached out. You're doing the right thing. You're doing a fantastic job. And we're going to help support you get to that next step. And that's what we really try to do.
Yeah, no, that's really special, because like we said before, it's hard to ask for help. And then after you get over that barrier, you're then facing, are they going to judge me? Are they going to think I'm a terrible person, a terrible parent? So the fact that you are willing to be a judgment-free, safe place that they can reach out and just talk or grab some services, that's really important, for sure. And now, Jacob, April is Child Abuse Prevention Month. Just how prevalent is this issue, and how does it impact the Cape and Islands?
Yeah, absolutely. So April is National Child Abuse Prevention Month, and so that's why we really wanted to make sure we had this conversation today to talk about this issue. And so nationally, in the United States, 1 in 4 girls and 1 in 6 boys will be sexually abused before their 18th birthday. And if we broaden that out, that's 1 in 5 children who will be impacted in some way by sexual abuse, physical abuse, domestic violence or significant neglect. And another huge issue related to that is that only 1 in 10 of those children will actually disclose their abuse, where they'll actually talk about what had happened to an adult who can help them. So that's not only to just a friend or a family member or somebody like that, that's to anybody. And we really want to bring this forward to talk about not only the prevalence, but where are those actual risks? And a lot of the times people have this belief that those that are harming children are these unknown individuals, that, strange person who's wearing the trench coat in the van parked outside the playground. But unfortunately, that's not the case. 90% of the time, individuals who do harm children are somebody that child knows. It's somebody that child trusts. And around 30 to 40% of the time, it's a family member. It's somebody who's related to them. And so when we talk about prevention, the very first piece of that is education. Understanding the issue, understanding the prevalence. Child abuse is a public health crisis in the United States. And it's one that unfortunately isn't given as much time as other public health crises that we experience, which are important. But when we talk about the long-term impacts of what we call adverse childhood experiences, they are very broad. And when a child has experienced what's considered 5 or more ACEs, adverse childhood experiences, they are far more likely across the spectrum of their lifetime to be diagnosed with a mental illness, to be diagnosed with a substance misuse disorder, to have compounding medical health effects, including 7 out of 10 early indicators of death, challenges with job security, education, finances, domestic violence, and further instances of assault. So when we're talking about prevention, we're not just talking about the prevention of 1 or more instances of childhood abuse. We're talking about the prevention of long-term compounding impacts on their lives. And so, talking about this issue is very important. Establishing those protective factors for families through the conversations that we have at Children's Cove and Cape Cod Children's Place really will change the nature of how children and families live over the course of the next generation. So, Cindy.
And now you had brought up that it's one of the least talked about public issues.
Yeah.
Why do you think that is? Is it difficult because it's dealing with children? What's your opinion on it?
I think that it's difficult, yes, because it deals with children. I think it's also difficult because when we have to talk about these issues, so many times individuals have to look in the mirror and confront that they've experienced something, and that this is an issue that impacts so many individuals that when we talk about it, it makes it more real. For so long, there were other health crises in the United States that were unmentionable. Cancer was one for a very long time. The HIV and AIDS epidemic for so long. And childhood trauma and childhood abuse is still something that is really difficult to talk about because it is unfortunately so prevalent. However, we're not going to be able to make a change if we don't talk about that. Cindy?
And I think, what Jacob said just a moment ago was about education, and really about it's such taboo, like if we don't talk about it, then they won't think about it. And so there's so many layers to this, but talking to our children about body safety and making that part of our job as a parent or caregiver, not only about body safety, but all safety, wearing a bike helmet, wearing a seatbelt, and how we tie that all together and start to talk about that. We know that everything tells us that when children are aware of what their body does and what their private parts are, and when they can name them, it's a key ingredient for their safety when they can talk about that and be able to bring that home. We get really uncomfortable at the thought of our children being harmed. And I think that it can come a layer of tremendous guilt, like, oh my God, I failed my child. And then there's times where our children bring up these amazing questions, because children are brilliant, and you stand there and you're like, oh, where do I go? And I think if I've learned anything on my journey and clearly sharing with other families, is the best answer to that question is, that's a great question. And when we can help parents find their comfort with that, I said, there's 100% chance if your child comes to you with something that you're going to want to throw up. That is absolutely part of this journey. Go in the bathroom and take care of that, but your child in that moment, this is a pivotal moment to really be present to them. And I'm so glad you asked me that question. So I do think that there's a lot of cultural pieces here that if we talk about it, then it becomes real.
Yeah, and the other part of it too is because it hasn't been talked about, it's never been role modeled for us, right? My parents didn't have that conversation with me. I doubt their parents had those conversations with them, but we've all seen those role modeled conversations about, how do you talk about smoking? How do you talk about drinking or substance misuse? How do you talk about teaching somebody how to drive or go on a date or those types of things? But we've never seen role modeled, how do you talk about body safety and what parts of your body are private? And what do you do if somebody asks us to look at those or touch those? How do you ask for help and support? And then how do we believe our children? It hasn't been role modeled as a regular piece of parenting. And just like Cindy said, is we'll teach about fire safety and firearm safety and sharp safety. Let body safety be another one of those that come into the conversation. And definitely now, too, in the far more digital generation, that element of online safety and incorporating that as a part of it, too.
Yeah.
Absolutely. And now, what are some steps that parents can take to reduce the likelihood of abuse to make prevention more possible?
Yeah, so just like we were saying is, taking that first step of talking about things. I think, we say at Children's Cove, one of our big taglines is have the conversation, right? Not avoid the conversation, but have the conversation, and have that conversation early when they're young, and have it often. It doesn't have to be a rehearsed, scripted, sit-down thing, right? I think the last thing any parent or person wants to hear is, we need to sit down and have a talk, right? It's terrifying when you have that. And so, an example that we give when we do some parenting education together that I'll give for parents raising young children is, when you're changing a child, when you're bathing a child, when you're bringing them swimming and putting them in a bathing suit and all of that kind of stuff, 3, 4, 5 years old, you just make a simple statement. Hey, I just want you to know the parts of your body that are covered by your bathing suit are private. And nobody should ask to look at those or touch those parts of their body. And nobody should be asking you to look at or touch their body parts in those places either. And then leave it at that. Because children at that young age, they're just going to absorb that information. That seems like a really scary conversation to start with, right? Or naming the parts of the body. But when children are really young, they don't have that context that we have as adults. We have, unfortunately, too much information. We know too much stuff, and that can be a barrier and get in the way. And so practicing those conversations early and having them often will pave the way to have those really challenging conversations when a child is 13, 14, 15 years old about dating and sex and consent. It'll establish that relationship and trust. Cindy?
And I think the other piece is to really understand the protective factors that I mentioned, and one of them is building the social and emotional intelligence in our children. And we, rather than build our child as an academic, that they have their numbers and their letters down, we need to think in terms of building children to be emotionally intelligent. Their EIQ should be the highest part of them. And when children grow up in a place where their feelings are acknowledged, when they can say, I'm mad, and we say it's okay to be mad, and we let them have that moment, what they do is they build themselves from the inside out. They're able to self-regulate, to take in information, but more importantly, it becomes their sort of internal mechanism that keeps them safe. It's that thing inside of me that says, that was a creepy feeling. I didn't like that feeling. When we do the opposite and we tell children they don't mean what they mean, they don't feel what they feel, it gets crazy land. And I guess that's okay because my belly told me that was creepy, but you told me my feelings didn't matter. This begins from the moment we meet this little person, how we start to talk and connect experience to emotion. So at the end of the day, I wish that all children had A+ in emotional intelligence. And if that is how we look at our job with children, we are going to create children that are able to be successful in life. And that doesn't mean they're going to have the biggest bank account. It means they're going to be healthy human beings.
Absolutely. It's beautiful that you put emphasis on emotional intelligence. I feel like as a society, as a culture, it's all, what are you getting in your history class, your math class? That's what's important. But you need to have that emotional intelligence to grow up to be a healthy person. Absolutely. And what should a parent or caregiver do if they have concerns for their child or a child that they know?
Yeah. So like we had mentioned earlier is, Children's Cove, we are an agency you can contact, you can reach out to, you can call us directly. You can visit our website. There's a lot of information on our website, which, will kind of give some more of those, are there warning signs, or these things that you're seeing, that you're hearing, that you're feeling. And we do have direct links on what to do and how to get help. But the most important thing, that if a parent, if you're concerned about your child, if you're concerned about another child, is ask for help, report it. I think that there's this place in the back of our mind, kind of like we were talking about, is, oh, well, that couldn't possibly be happening. And then we may not choose to take action. The real fear for me is that, what if it is happening and we choose not to take that action and it continues or it gets worse? So if there is a concern, there's somebody you can talk to, you can reach out to us directly. But most importantly is contact someone. You can go to a local law enforcement. You can contact the Department of Children and Families, which is the child protection agency for the state of Massachusetts. You can contact us directly at Children's Cove, or talk to an organization or another adult who you trust on that next step. You can contact Cape Cod Children's Place and talk through that there. There's so many organizations that want to help, and we do that confidentially and privately.
Yes, and that's really important to it. And I think also, from the lens of that parent place, when someone says, I'm not sure, some of the ways that I often think to understand what's going on in a child's world is watch them play. Children will tell us a lot through their play. And in addition to reaching out, as Jacob said, really listen to your children. I think one of the things that we didn't mention, which I think is part of this culture too, is we often don't believe children. And because we are a center that really focuses on the child and the family, as an early education center, we are going to believe the child first. And it sort of numbs my brain how many times, do you think that's true? And I'm like, they've said it, so yes, I'm going to believe it to be true. And then we'll find out from there.
Yeah, there's, and to reinforce that, there's a lot of statistical evidence and studies and research that have shown that children are tremendously believable, and that even when presented options to not tell the truth, they'll still tell the truth. And so, so believe children, believe children, believe children.
Yes.
That's beautiful. Absolutely, yes. Well, thank you both so much for being here and taking the time to talk about these important issues that we need to bring to light. We need to stop being afraid to have these discussions. We need to normalize talking about your body and body safety, right? So thank you both. If you want to learn more about these organizations, you can visit CapeCodChildren'sPlace.org and childrenscove.org, or find them on social media. Thank you, Cindy and Jacob, for being here today.
Thank you, Emily.
Thank you very much.
Thank you.